Hello everyone, this is Dr. Sushmita. I hope you all are doing good. Today I have come up with another interesting chemical, which is a pulp devitalizing paste and gel by Waldent. So let's discuss all about this product. Waldent Devital Pulp Devitalizing paste and gel contains paraformaldehyde as an active devitalizer that causes rapid mummification of the pulp and is used when anesthesia fails to be effective for pulp extirpation. It contains paraformaldehyde, parachlorophenol and camphor. Waldent Devital Pulp Devitalizing paste and gel is used prior to extirpation of pulp. It is also used for residual devitalization after removal of non-vital pulp tissues. It comes in both paste and gel form. It causes rapid mummification of pulp and relieves pain. It should not be used routinely. A proper isolation should be done before using it as it is highly toxic. For the application of Waldent Devital Pulp Devitalizing paste, take a small quantity of paste and place it inside the access cavity. Then insert a cotton pallet over it and seal it hermetically with temporary filling. For Waldent Devital Pulp Devitalizing gel application, attach the dispensing tip to the gel tube and eject a small quantity of gel directly inside the access cavity. Then insert a cotton pallet over it and seal it hermetically with temporary restoration. Extreme care should be taken during its use by properly isolating the surrounding tissues from the tooth, as paraformaldehyde is extremely toxic, which places in contact with the tissues of the body can cause necrosis of the gingiva and alveolo-cortical bone, which can result in great loss of the supporting bone. Thanks for watching, and if you like the video, then like, share and subscribe to our channel.